Type 1 diabetes is a chronic autoimmune disease. In type 1 diabetes, the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Insulin is a hormone that regulates blood sugar levels. Without insulin, glucose builds up in the bloodstream, leading to various health complications. Current treatment options for type 1 diabetes primarily focus on managing blood sugar levels through insulin injections or insulin pump therapy. While these methods are essential for managing the disease, they do not address the root cause, the destruction of beta cells. This is where stem cell therapy offers a promising avenue for a potential cure. Stem cells are unique cells with the remarkable ability to differentiate into various types of cells in the body. Scientists have been exploring ways to utilize stem cells to generate new insulin-producing cells, effectively replacing the damaged beta cells in the pancreas. A recent groundbreaking study published in Science Advances has provided significant hope for people living with type 1 diabetes. Researchers successfully reversed diabetes in mice using a novel stem cell therapy approach. The study involved transplanting human islets, clusters of cells in the pancreas that contain insulin-producing beta cells, into diabetic mice. To enhance the success of the transplantation, the researchers employed a novel technique using reprogrammed vascular endothelial cells, or RVESs. These specialized cells play a crucial role in forming blood vessels. By co-transplanting RVECs with the human islets, the researchers aimed to improve the blood supply and survival of the transplanted cells. The results were remarkable. The transplanted islets, vascularized with RVECs, successfully integrated into the mice's circulatory system and began producing insulin in response to blood glucose levels. The mice, which were previously diabetic, showed significant improvements in their blood sugar control, effectively reversing their diabetic condition. Traditionally, islet transplantation has been performed by injecting islets into the liver. While this method has shown some success, it has limitations, including the risk of immune rejection and the need for lifelong immunosuppressive drugs. The study's researchers explored an alternative approach, subcutaneous transplantation, where the islets are implanted beneath the skin. Subcutaneous transplantation offers several advantages over traditional methods. Firstly, it is a less invasive procedure, reducing the risk of complications. Secondly, it allows for easier monitoring of the transplanted islets, and, if necessary, retrieval. Lastly, the subcutaneous space provides ample surface area for transplantation, potentially accommodating more islets and enhancing their survival. The success of subcutaneous islet transplantation in this study, combined with the use of RVECs to enhance vascularization, marks a significant step forward in diabetes treatment. This approach could potentially address some of the limitations of current transplantation methods and pave the way for a more effective and less invasive treatment option. The groundbreaking results of this study offer a beacon of hope for millions worldwide living with type 1 diabetes. The ability to reverse diabetes in mice using stem cell therapy and subcutaneous transplantation is a significant scientific achievement with the potential to revolutionize diabetes treatment. The use of RVCs to improve islet vascularization is a game changer. It addresses a critical challenge in islet transplantation, ensuring the survival and functionality of transplanted cells. Improved vascularization allows for better blood supply and oxygenation, enhancing the chances of successful engraftment and long-term insulin production. While these findings are incredibly promising, it's essential to remember that this research is still in its preclinical stages. Further research, including larger animal studies and eventually human clinical trials, is necessary to determine the safety, efficacy, and long-term effects of this approach in humans. The journey from a groundbreaking discovery in mice to a viable treatment for humans is complex and requires rigorous scientific investigation. However, the potential of stem cell therapy to provide a cure for type 1 diabetes and alleviate the burden of this chronic disease is a goal worth striving for.